for outbreak response. And I'm going to do a quick introduction of our colleagues who are online who are going to support with the facilitation over here. So you can see again, my name is Lorraine Shamala. I'm the C4D specialist with the polio program at headquarters. I focus on capacity development, and I'm here to support you. Whatever you need, please contact me. And I'm from Nairobi, Kenya, and I'm going to hand it over to my colleagues. Tommy?
Yes, good morning, everyone, and good afternoon. My name is Tommy Laulajainen. I'm also in the headquarters polio C4D team. I'm a C4D specialist. I worked for polio for a number of years in Africa and in Afghanistan and Pakistan. And I'm part of the facilitation team here with Lorraine and also Thomas from the Rapid Response Team and Claude from the Wakaro office. Thank you very much.
Okay, Aaron, if you'd like to give a quick introduction, please.
Good afternoon, everyone. Yes, my name is Erin Bogue. I'm the Knowledge Management Consultant with the Polio New York headquarters, and I will be supporting any issues, technical issues with facilitating the training. Thank you.
Thank you, Erin. And I have my colleague, Claude, who is online from our regional office. Claude, if you can please introduce yourself. Claude, are you there with us?
Yes.
Yes. Thank you, Claude. If you can introduce yourself, please.
Okay. Okay. Bonjour tout le monde. Je disais, mon nom c'est Claude.
Good morning and good afternoon, everyone. I am Claude Tasselmos. I am the polio specialist in charge of coordinating polio activities in the rapid response team. I am based in Dakar, where I'm working in cooperation with colleagues from New York headquarters. And we are here, of course, to support you as part of this training. Thank you and have a good session.
Thank you, Claude. And I'm going to hand it over to Thomas, who will introduce himself and also my colleagues from the country office and from the Ministry of Health. Over to you, Thomas.
Okay, merci. Moi, c'est Dr. Thomas Noël.
Thank you. The name is Dr. Thomas Noel, C4D specialist. I am in the rapid response team, and I'm currently on a mission. I am happy to be joining you for this training.
Thank you, Thomas. Could you please also introduce our colleagues from the country office and also from the Ministry of Health?
Okay, Elodie,
Elodie, can you introduce yourself and introduce your team as well? Elodie, over to you. Thank you, Thomas. I am Elodie Zekaba, in charge of Communication and Social Mobilization Department. I am with my team, including Mr. Kono Malanda, who is a Monitoring Evaluation Officer, and my colleague Esther Nomu. I think Maggie is online, and Mrs. Vichka. Thank you.
Lorraine, vous avez, voilà.
Thank you. Lauren, we are done. Over to you. Hello, Thomas. Can you see me? My name is Sandra. At the Brazzaville country office, I am a C4D officer. So I am going to be working with the consultants when Thomas has completed his important mission. Thank you.
Okay.
Thank you, Sandra. Lauren. Sandra.
Yes, thank you. Thank you, Toma, and nice to meet you all too. So before we start the training, like going into the sessions, I thought, and I was requested to take a couple of minutes to actually go through some slides and to let you know what we do in the GPEI program, which is the Global Polio Eradication Program, and what we'll be doing through this training course. So just a reminder that during the training course, as you can all see, we are actually using Zoom. We've done a couple of trainings or webinars like this, so please bear with us if we have issues that are going on. Please also note that we are using interpretation both in English and in French. The sessions will consist with some short presentations in some of the sessions, not necessarily in all of them. We will also try and use some breakout rooms where we can just speak organically and free and get to really hash out some of the issues that we're discussing. And we might have a couple of polls here and there, as you saw, Aaron did one this morning. Just so you know that this is a 2-day training. We will be 1 hour longer today than we will be tomorrow. This is also a very abridged version of the training that we usually do these over a few days. So if you do need any additional information and any support, please do reach out to any of us that are currently on this call. We have lots of resources and we can take the time to spend with you and go through this information more in detail. Really quickly, I would just like to talk briefly, just so that you have a background on how we operate. We are part of the Global Polio Eradication Initiative, and it consists of these partner agencies that usually have very specific roles in what they do. As you know, that the GPEI was originally started in 1988 by the Rotary, who said, let's get together and let's look at a way that we can eradicate polio. And they mainly focus on our advocacy work and our fundraising. Of course, UNICEF, where we have the main role of doing the vaccine procurement, cold chain logistics, and the communication component, which is what we all do over here as to why we're all present on this call. Our partners at the CDC, who do a lot of our laboratory support. And for those of you who have taken the STOP training, who also collaborate with us for the surge deployment for STOPs. And then WHO, our partner, who does most of our technical work and surveillance, which is huge for what we do. The Bill and Melinda Gates Foundation, who are technical experts and also do our funding. And then, of course, Gavi, who joined recently, part of the initiative that helps us take a polio program also into routine immunization. Just to give you a breakdown of how we are structured, we have a global team that is broken up and sits in 3 main offices, and we support each other. So we have the team that is based in New York, where Tommy and I sit, and Aaron, and our role at the global headquarters part in New York is we have the H&I team, which works on more of the immunization component. And then we have the C4D component and the resource mobilization. And from that, we also give support both to the endemic that is based out of Oman, that focus mainly on Pakistan and Afghanistan. And our role is also to give support to the outbreak cell that is based in Geneva, where Thomas is and my other colleagues. And they work on the high risk priority countries that have outbreaks and are also high risk for the potential of outbreaks or neighboring countries. So that's just a little bit of a background on the structure of headquarters. And of course, through headquarters, we work with our regional offices, with our colleagues, Claude and in Asaro and in the other regions, and then with the country office support. So I just want to give you a little bit of the background of how we will set up these next 2 days of when we look at this sort of training. I do also want to completely remind myself that most of our colleagues on the line are going to be giving a lot of support to the program. You will be doing a lot of coaching and mentoring. You will be working with supervisors and trainers in the field. But I want to give you a little bit of a perspective of when we look at these trainings, how we kind of set this whole thing out so that it continuously supports Okay, so we kind of look at it through the lens of a microplan. I know that Claude has been working with you in the past week where you have been working on microplans, but as communication officers, as behavioral change people, there are certain components that we have to look at to make sure that we can carry our work out in the field. And so over the next 2 days, we will briefly talk to you about this. We will look at training in the context of COVID-19. We have to, this is critical, it's part of our role as health officers. We will look at polio basics and address any questions that you might have. I believe that Claude already started this last week. My colleague, Tommy, will actually talk to you about crisis communication, which is a huge component of our work with community engagement. We will look at the importance of data in the work that we do. We will, of course, look at how we engage our communities to make sure that we can identify the target audiences that we are trying to reach. Microplanning and social mapping, and then community engagement, and something that's very critical for our work today, of course, looking at misinformation and rumors, not only in the context of polio, but what is the effect also that might be happening globally as a pandemic that's affecting us. I put the schematic up there just to remind you that when we look at polio outbreaks, we look at them in phases. Right now, if we look at Congo Brazza, we can say it's more in the outbreak phase. So when we will be addressing some of these issues, we might not touch on data so heavily, which is what we usually do in an enduring phase, which is usually between 3 to 6 months, and Tommy will get into that when we get more data, and then the routine. But this is more just to show you that these are different components of what happens during an outbreak and how we address these different components. So we might not be heavy on some of them through this presentation or these 2 days of trainings, but these are things that we can come back to later. I'm just going to go really quickly for the sake of time into the next component, which is just touching on the context of COVID very quickly. I know we might have some questions that we would like to come to, but we've actually, sorry, I'll come back to that, but we've actually set up time in one of the sessions to come and discuss that. So really quickly, okay. I can't hear any colleagues, so I hope you're still all there with me and we're just all on mute.
Yes, we're here.
Okay. Okay, so can you see my screen right now?
Mm-hmm. Yes,
okay, great. I think it's important. I'm actually going to fly through this for the sake of time, and I'm sure we've been touching on this, but I think it's important that we do discuss this because, as I said, as mentors, as supervisors in the field, as part of UNICEF, it's important that we remember that we are working in the context of COVID-19. And when we look at campaigns, we do go door to door. And when we go door to door, it is important for us to remember as health officers, as C4D specialists, that one of the most critical things for us is to always keep in mind the duty of care and to do no harm, which comes from our Hippocratic oath. It is what we do when we become health officers. And we have to remember two things, and these are critical for us, for, as I said, for campaigns. One of them is to remember that it is our responsibility to make sure that we keep our communities safe. The reason we bring this up is because remember, when we go door to door, we have to remember all the things that we need to put in place in the protocols to make sure that we keep our communities safe. But it is also very important for us to remember that we have to keep our health workers safe at the same time. And I want to remind us also that it's not just keeping our health workers safe because of the fact that we are in a pandemic and that it could be disease related, but also keeping them safe for their own safety as they go door to door when you think about this in the context of misinformation. Okay. Just for me to remind you that your role, as I said, as a coach and supervisor, to just always remember that we remember about interpersonal communication skills, how we talk to our colleagues, how we help and support frontline workers who are in the field. There might be a lot of stigmatization. Are we taking this into account? And are we keeping into place those certain things that are critical to make sure that the work has been done correctly? Also, a small reminder that this will vary depending on what country you work in. When we protect our health workers, we always come back and we have to look at what the government gives us and what the national authority says are the rules and regulations. So we can set guidelines in our work, but it's very important to remember that we match the guidelines of the work of what we are doing in the country offices. And this is just, these presentations will actually be in your resource folder, so you could go back and look at them in depth. But it's just to remind you that they are current things that we keep in place to remember to do, as far as the social distancing is in place, about the hand sanitation, what you're supposed to do, and wearing of masks. I did say it's important to remember that it's based on national government, because different countries do vary with the regulations of what they have in place. It looks like there's a slide missing in here, and it could be in one of my other documents. Yeah, I think it's in the last presentation, which I will just show you very quickly. And because of, before I hand this over to my colleague, Thomas, who will look at polio basics, there is a presentation in here that there's a document that I would just like to speak about briefly. And just as a reminder that I keep trying to reinforce this into all of us. Our job is not just how we do our facilitations when we do our trainings, but also how we do our coaching and our support supervision. And we've actually developed a document for that. And this was done by one of the committees in the polio eradication program. And it was very important for us to look at what we do when we go door to door to work in campaigns, and also what do we do as trainers to make sure that we set up safe environments, not just for our frontline workers, but also for the people that we're training in the rooms. I have this version in English. I need to check back with the Geneva team to see if the French edition has come out, to make sure that it goes into your resource folders. But this is a document just to show you that we have thought this out systematically for your campaigns, for the introduction of NOPV, etc., of how do you go about doing this. Just a few reminders as I brought them up before. Your role is as a supervisor. If you are in the field, you are a coach, you are a mentor, to remember that people are dressed appropriately to make sure that they stay safe. To make sure that most of the people who are coming on board, who are social mobilizers or vaccinators, do come from the local area so that they stay within their communities, and to make sure that they are implementing the guidelines correctly. Aaron, do you need me?
Yes. The interpreters request, do you have a headset you can use for the microphone to be optimal for them? It's audible, but would it optimize when you have?
Okay, I will do it for the next sessions when we do them later, but we only have about 2 slides in this, so let me just finish with the flow of that, and then I will get some. This is a slide. It's just reminding us of when we do train to remember the critical things that you would look at quite differently in the context of COVID-19. You would look at how you interact in rooms and the activities, and when you look at group work, are we doing the proper spacing that we have to take into consideration, just with like our children when they go to school? Are we setting up enough time and space? As you can see just from this training, we are doing it with Zoom, we're doing it in multiple languages, so we have to take all these things into consideration. Look at your audiences that you're still working with, make sure you have the right resources available. And what do you need to do in the context of COVID-19 when you're training? Remember that a health worker who may be going door to door may not have to only just deal with refusals, but based on polio, or questions that might come up based on that. But there might be questions that come up from parents and caregivers based on other issues to do with COVID-19. So just keep these things in mind when you are conducting trainings. Also, as a reminder that people learn differently. Some people look at things visually, some prefer to listen, some prefer to read on their own, and some prefer to do things by hand. So whenever we do coaching, whenever we do trainings, it's important for us to remember as mentors that different people learn differently and take that into consideration, how we retain information. And sometimes we are working with populations who come from a lower literacy environment. So it's important to remember that they will retain information differently than how we may and may not have all the documents that we do. So to keep that in mind. Okay. With that said, I think we're back on track time-wise over here. I'm actually going to hand it over to my colleague, Thomas, who I believe shared the agenda, or the agenda has been shared. And Thomas is going to lead us into session 3, I believe, Thomas, which will actually look at polio basics. So we're going to save questions for after we finish the first few sessions this morning, and then we will come to that. Over to you, Aaron. And Thomas, yeah.
Thank you, Lorraine. Let me pull up, share my screen.
OK. OK, je demande un peu dans mon groupe ici s'ils ont des préoccupations.
I'd like to find out if my roommates have any concerns. Lauren, are you going to take care of concerns now? Or do you think they can ask questions now?
We prefer to do it after Tommy's session. We have a time slot put in there where we will come in and then we will take all questions at the same time.
Okay, okay, merci.
Okay. And really quickly, Thomas, before you go on, Aaron, I will present, do you want me to bring up Thomas' slide? It's just one slide. Voila. Okay. Over to you.
Okay. Okay, donc, all
right.
Lauren, I can go ahead for this.
Yes, please go ahead.
Please go ahead. Yeah, this was your review session.
Okay, merci à tous. Je crois
Thank you to you all. Actually, the underlying idea of this short one-slide module is that it's important as C4D specialist for polio that we have an idea of the basics of this disease for which we communicate, for which we are likely to raise awareness and inform communities so that they buy into the vaccination program. So it's a reminder, it's a short reminder. Clearly here you can see the 3 types of polio type 1, type 2, type 3. This is just for the purpose of our presentation. But polio, first of all, is a virus. It starts with a virus. I would like to recall here how people get it. You know, people say that you get infected through the mouth or through faces. Usually it happens for children playing with the earth, with the sand, and then they put a finger, they stick a finger into their mouth. But there's another kind of infection, but the main one is the oral fecal transmission infection. It's important to also understand that the reservoir of that virus is mankind. That's why we are talking about eradicating it, because it's the only man who can eradicate the polio virus. The thing that you should know is the diagnosis. even if you are a C4D specialist, it's important that we are aware of the confirmation diagnosis that is done in labs. Cases should be actually reviewed at with two intervals, and it's 14 days after the paralysis happens. It's then sent to the lab. When a child comes over, you can also check some symptoms, muscle aches or fever, but not enough to confirm whether it's polio or no. It's the lab exam that will confirm whether the child is infected or not. In terms of treatment, it's important to know that there's no treatment against polio. We are using immunization and prevention. Polio immunization is an oral immunization system, and we also use the VPI. These are the two alternatives that we're using. Otherwise, we would use a non-symptomatic treatment, but if a paralysis happens, there's no real treatment. We are using prevention measures, and that's the resource that we are using. It's an opportunity also to remember that we have to take into consideration the way people are getting infected in terms of having a healthier environment and also making sure that family interactions are done in a safe fashion. Today, among the polio cases, you know that we are really responding cases in the Wakararo area. It's polio which comes from the vaccine strain. The important information here is not to say that it's the vaccine that infects people, but it's due to the fact that in our communities, our children are not properly immunized. We haven't also achieved herd immunity because that's this vaccine that enabled Africa to be wild polio exempted. So we need a good quality immunization program because the vaccine is mitigated. So, when a community is not properly vaccinated, then infection can set in. So we are in a situation where, as C4D specialists, we should do everything that we can to raise awareness and communicate properly, laying the emphasis on the fact that we need to have a community to be properly immunized. We need to achieve herd community. This is just a reminder on polio so that we are on the same music sheet so that also when we communicate, we know exactly where we stand. So, Lorraine, this is what I would like to say. Should you have any questions after, just like you said, of course, we will be available to give you more detailed information. Thank you very much.
Hi, Tama, it's Lorraine. We still have a couple of minutes. I will hand it over to Tommy to see if there is anything he would like to add.
No, I don't have anything to add. So unless people have maybe questions at this point, maybe they could ask Thomas and Claude questions that are specific to the polio basics.
Absolutely. Aaron, if we can open it up to questions, especially since they had this session last week, and this is supposed to be more if they have any questions they would like to bring up.
Absolutely. So if anyone has questions, please use the raise hand feature. If you look at your Zoom toolbar, there's an option to raise hand, and I can invite you to speak. So please, any questions for Thomas on the basics of polio, on any of the topics that he has covered and that was covered in the previous session? And if anyone is in the room with Thomas and has questions, Thomas, you can unmute and bring those questions to the virtual room.
OK. Lorraine, je crois qu'on a des questions dans...
Lorraine, I think that we do have in our room a number of questions that we'd like to raise. Simon would like to ask a question. Chris as well. I think the both of them, well, three of us have questions to raise here.
Sure, Thomas, if they can proceed, and if you and Claude can also give us some support answering the questions, please.
So Thomas, as each participant...
Je vais poser une question suite à la
I
présentation.
would like to ask a question after Lorraine's presentation. There was a slide where I could read the role of the supervisor, and at the bottom, I could read directives in terms of PPE. I'd like to know what are the PPE directives in COVID-19 environment. And I would like also to know what are the directives that are meant to door-to-door staffers that are on site. Well, we are jotting down your question. You may want to ask a second question to Lorraine. She will answer at the same time. Chris?
Sure. If you can give me the question, please.
Bonsoir à tous.
Good afternoon, everybody. Simon Emon is my name. My question is about the C4D. When I looked at the various steps that have been suggested, the approach that has been suggested for the C4D, I had a mixed feeling that there are things that have been slightly changed. Can we get the slide back on again, please? I have the feeling that a number of things have been slightly changed.
Okay, so we're talking about the slides that have the circle, because what I would request to do is, like, after Tommy has done his session, we want to come back and address all those. Sorry?
Could we have the translation for that?
Yes.
And Laurent, this is the slide before the circle.
Okay. Yeah. I have Tommy's presentation ready to go. So is it on facilitation or on COVID? Is it in this presentation? Because we can come to these questions all during the Q&A. Is it this slide? Oh, you can't see it.
Okay.
Yeah, we can't see any slide, Lauren, from you.
Yeah.
Do you want to switch screens or keep these questions for the question and answer and limit?
Can we keep them for the question and answer, and then we can
so we do have a session after the next presentation, open question and answer on any topic. For now, if you have questions on polio basics and this only for this section. We invite questions on polio basics and the information Thomas has discussed. Thomas, any questions in the room specifically about this session?
Okay. If not, Aaron, then I suggest that we...
Juste une question, il y a... Vas-y.
Bonjour à tous.
Good morning, everybody. My name is Chris Dafumbuda. I'd like to ask a question regarding investigations before a case is declared. I think that investigations before the declaration of a case will enable us to better understand what Thomas just explained. Lorraine, let me answer. Shall I answer the question now, or shall we get back to that question after?
No, please answer it now, because this is actually a Q&A part for polio basics.
D'accord, ok. Merci bien. En fait, ce qu'il
est
bien...
All right, thank you. Well, it's worth noting that when there's a paralysis that sets in, then bases will be sampled. Those samples will be sent to the lab. And just like I said, only the lab will provide the effective and the confirmed diagnosis that it's a polio case, that it's a PFA case resulting from polio information. When you have that confirmation, then on site, what we do is that in less than 3 days, when you have the notification, there's a joint team with the epidemiologists coming from CDC and WHO. There's also the communication team that usually comes from UNICEF with the support of the Ministry of Health. That joint team goes to investigate on site and will take 2 samples, contact the cases in the direct environment of the individual, and also samples from the community will be taken. And regarding C4D, we will take that opportunity to have information about the status of immunization of the infected person. That will be used to draft the joint report. So it's based on that the response plan will be worked out, as well as the various strategies. That is basically what we do. These are the various steps that we are using. I don't know whether Lorraine or Tommy would like to add more information, but that's basically what it is. Thank you very much.
Not from my side, maybe. Tommy, do you have anything to add to that?
De mon côté, Tommy, est-ce que vous avez besoin d'ajouter quelque chose? Non, je pense que ça a été bien expliqué. On pourra revenir
I think the interpreter is in the...
tard si davantage de précision est nécessaire.
Maguette, you're in the English room.
Oh, I'm sorry. So I have nothing to add. I think Thomas explained it really well. And if the person who asked the question still has need to have clarifications, maybe when we have time for a Q&A, we can come back to this question. Over.
Okay, any other questions on polio, the basics of polio? Thomas, any questions in the room? If not, we can move along to Tommy's presentation, right?
Sure. If not, let's move on to Tommy's presentation. Then we'll have the quick short break and then go into discussion, coming back to it. Aaron, do you want to control it from that side? Because that doesn't have to come out of the Dropbox, or? would you prefer if I just
If you
do
have
it?
it up, you can.
Yeah. I have.
Oh.
I'll control it for you, Tommy. Let me just share screen. There it is. Okay, can you see it? All right.
Yes, I can see it. Just keep it there. Okay, so good afternoon, everyone. We have a number of slides on explaining how the C4D response in a polio outbreak is structured and how we should proceed. A lot of this work has already been done in Congo Brazzaville with the leadership of the Ministry of Health and with the strong support from the regional rapid response team. It's just a reminder for the C4D consultants, both international and national, on the structure of the response from the C4D perspective. I also have a few slides on crisis communications, and this has become increasingly important area for the polio program, particularly in the current COVID context, to be prepared to address any type of misinformation, rumors, crises related to the actual vaccine, MAPIs or AFIs or other vaccine-related events. So just a reminder again for the C4D consultants, and I'll talk about a little bit how they can support crisis communication when they are eventually deployed to the districts. So next slide, Lauren. Here's just for you to read generally how C4D, one way C4D can be defined. Basically, to put it in a practical polio context for you, and again, bearing in mind our C4D consultants' role in the field, what is really important is for you to be in a position where you can identify issues and problems, coach and mentor the teams that are on the ground that have a lot of capacity but might miss some points when it comes to ensuring that communities are well informed and well positioned to accept multiple polio vaccines in an outbreak. Just to remind you, even if we have now 2 rounds planned for the MOPV2, there's no guarantee that the outbreak will be contained. Just think about what happens south of you in DRC. I think the first CVDP outbreak there occurred in 2017, and they are still struggling with multiple, I think over 9 or 10 different outbreaks of CVDP2. So polio program and outbreak response is critical to contain the outbreak, but sometimes it is not possible for various reasons, and they are all the time linked to the quality of campaign. And one element of the quality of campaign is how the C4D work is strategized and actually implemented at the operational level. So that's why your C4D consultant, your role in the districts is really to look at the operational district level communication and C4D plans and trying to understand if they have done a quality job in terms of mapping special populations, having a mechanism in place to address rumors and misinformation, and ensuring all the efforts, all the efforts within the community are being maximized to increase vaccine acceptance and demand in these communities. So I feel that this is really critical. You are deployed as UNICEF C4D consultants. So there's an expectation that you provide that solid C4D coaching and mentoring and support at the district level. While the districts have strong teams, they still welcome, I'm sure, further support from you. Next slide. This is the C4D socio-ecologic model, which I think Lauren will look at it in more detail in the community engagement session, so we can move on from that. So in an outbreak, the C4D, sometimes I've found in the field people, particularly those who are outside UNICEF, perceive a certain confusion between external and media communication and C4D. But they are actually totally complementary. And as you know, C4D is using multiple communication channels, whether they are media related or community level channels and networks. So they are complementary. But in an outbreak, normally we would see that in the beginning of the outbreak, when it has been confirmed, there would be a stronger effort through mass media to inform certain populations that there is a higher risk now for their children to be infected by poliovirus that has been identified in their community, to inform people that there's an outbreak, increase the parents' risk perception of the disease and their understanding and support for immunizing their children against polio as the only way to protect their children. And once the outbreak response is designed, the strategy in place, and the C4D plan in place, which is now the case in Brazzaville, there's more and more work that is happening at the community level and not so much in the mass media, because we truly believe that the community engagement, identifying all the important influencers, working with them rather than bombarding them with mass media messages, is the most dynamic and most effective way of achieving support for immunization campaigns. Next slide. Can you click two more times to get the boxes? Yeah. So often in the polio outbreaks, we look at the two phases. The first phase is the immediate communication response phase, where the outbreak has been identified, and the focus is really engaging a mass communication to sensitize the public and increase their understanding of the polio disease and their understanding that the vaccine and vaccination is the only way to protect their children from this outbreak. And often we look at that we're reaching maybe the 90% of the population who are what we call acceptant. Now I'm losing my English. They are acceptors. So they normally wouldn't have an issue with vaccination. They have the correct information. They have the correct intent to vaccinate. And when the campaign happens, they will ensure that their child is available and they will accept the vaccination. Then when we move on from this immediate phase, we call it entering in a more adaptive communication phase. And this could be in the Brazzaville context after the first round, when we start receiving campaign results, the immunization coverage. We will receive the independent monitoring data about populations and segments of population who have accepted, who have refused, for what reason, where children are as a majority absent, and why are they absent. So we start analyzing more reasons why children were not vaccinated in a campaign, and we start in a more community-based, deeper way to to address very specific issues in specific areas of the country. And that's when we also often we identify those populations, what we call rejectors, who reject vaccination. And often this
Can we please ask Margaret to switch off the interpreter? We're taking over. We're switching interpreters, sorry. The chat is not working between interpreters, so we need to inform them through you, sorry.
Thank you. You can continue.
Should I wait a little bit?
You can continue.
No, you don't need to. You don't need to. It takes 1 second.
Oh, okay. Yes. So so that's where I would say the C4D, the more community-based C4D efforts kick in this phase, what we call an adaptive communication phase. And I'm hopeful, and I'm sure everybody who works in the polio program are hopeful that the 2 MOPV2 rounds in Brazzaville would contain this outbreak, and there wouldn't be a continuous effort or to contain further spread. But if it's not possible, we will be working in this adaptive communication phase, particularly addressing populations who have missed the vaccination for various reasons. And there can be reasons that are not only communication related, often they are operationally related. I think in the latest AVS, in the campaign SIA in Brazzaville in 2019, the main reason for missing children was that the team was not visiting. So microplanning, the team's not visiting the houses, missing entire communities can be a much bigger reason why children are missed rather than communication. But communication can also be one of the reasons. Next slide. This slide is just to talk about how the media still will be playing an important role as well in C4D. And I think already in the current C4D plan that the government has put together with the support of partners, there's a good interconnectedness between media and the C4D efforts. So it's a good sign, it's a quality plan, and it definitely will help the country to at least strategically address the right issues. Next slide, sorry. So the hours there are indicative, but it just tells you how the GPI, the Global Polio Eradication Initiative, considers, and as does UNICEF, polio as an emergency where rapid response to the outbreak is critical. I think the country has, if you look at in the slide, there's some text is in orange. The country has already completed these phases. The C4D key messages were designed, and they are hopefully, if not already, then soon be circulating in mass media. There is a communication and social mobilization plan, and I think when the first case was identified, there was a joint mission between government, WHO, and UNICEF to look at the case, and looking at this from the C4D perspective, the socioeconomic and demographic data of the child who was identified as the first CVDP case in Congo Brazzaville. Next slide. And you can click all the boxes. So here again, just to remind, normally in a polio outbreak response, within the first 2 weeks, there would be already a rapid response team member in the ground, helping the government and working with the UNICEF country office to develop these different elements that are critical for the polio outbreak response, and that need to be in place if we are to have a quality campaign and quality coverage. That obviously would lead then us containing the outbreak rather than allowing it to expand and spread further in the country. Just a reminder, I don't have to go through the text, you have them on the screen. So, And also these presentations will be in your resource package. So, and the last slide I think on this issue is that there are certain standard operating procedures that I think we also share in the resource package with you that looks at how in an outbreak country the global polio eradication initiative tries to support it from the global level, from the regional level, so that in countries where there haven't been outbreaks, often there are less capacity to quickly mount a campaign and a response, and therefore there's a need to send external support. But eventually the Team B will be in place and can support the country in the response. And there will be, believe it or not, in GPEI, every outbreak is monitored at the highest global level, and there's a lot of pressure within the partnership to all the partner agencies, whether it's WHO, UNICEF, or others, to provide maximum support for quick containment of the outbreak. And that's why it is so critical that the consultants, whether it's international consultants or national consultants, are put in place quickly and given the appropriate briefing so they can be providing maximum, optimum technical support in the field. I can't stress enough how important this is, although it may seem not so important when you don't deal with outbreaks all the time, but UNICEF's accountability, like Lauren showed in the beginning, is in the C4D and vaccine management and procurement, and we are held accountable at all the levels for the areas. And equally important in this response are the global level people, but much more so those people, and I'm talking to the C4D consultants, who are being deployed to the districts and who are perceived as a UNICEF consultant, and therefore their efforts are perceived as being UNICEF efforts equally so as much as the country offices, the regional offices, and the global offices, global headquarters efforts. So it's really critical for us to get our best foot in the front and get the best results possible in the area of C4D. Next slide. I think now I'm just jumping into the area that I think many of our colleagues from the EPI, the PEV, already joined the session with the McCann Global Health on crisis communication, but also just I want to talk about this a little bit and then try to address maybe some of the roles that the national C4D consultant who are deployed to the field can play in terms of being ready for any eventual crisis communication event. So next slide. It's just that's just a general kind of a message saying that in a crisis situation, the right message at the right moment by the right person can save lives and can actually can also stop a crisis from happening and expanding and amplifying, whether it's offline or online. So the right message, the right moment by the right spokesperson is critical. We look at the crisis communication, there's a certain cycle. I think you jumped one slide there. So the pre-crisis work that I think we undertook the first time ever in the polio program with the McCann Global Health, and it's unfortunate that our C4D consultants, national consultants, were not in that, but at least the EPI and the country office have been exposed to this. There's a certain preparation that we have taken in terms of helping the country prepare for a crisis, identifying potential crises, and having Also some standard messaging that can be used if and when any type of a crisis linked to the vaccine, rumors, misinformation about vaccination against polio, if those situations arise. Initial phase talks about the messaging and showing empathy, being the first to communicate, establishing credibility, not trying to hide information, and recommending any further actions that should be taken within that crisis situation. Entretien explain in more detail the risks to certain populations, providing solid information on the crisis situation, acquiring support from different players within the society, medical associations, etc., GPI spokesperson, the Ministry of Health, whoever is a credible spokesperson for the crisis, and then making the right decision in a situation on the crisis. So sometimes if we don't assess the crisis correctly, we might be actually amplifying the crisis by starting to communicate about a certain situation. So I talk about that later. And then eventually having a broader public communication to educate the public about the situation, examining further if there are issues and problems, and getting all the support, political and other support for the crisis situation, and promoting the right communication, right messages within the broader mass media. And then at the end of the crisis, you would have, like in Brazzaville, we have now the crisis communication management team that will look at all the aspects of what happened, what was done, how it was done, was the process appropriate, was the messaging appropriate, did we have the right credible spokespersons, and improve the crisis communication plan based on that experience. Next slide. This is just to repeat what I think was earlier in the message. This is from the CDC risk and crisis communication guidelines. Be the first, be correct, be credible, show empathy, encourage any action that is relevant to the crisis, and be respectful. Next slide. This is also from the CDC and WHO, I think, in terms of the vaccine-related event that can happen. We have worked in routine immunization and polio campaigns. There can be a AFI or MAPI. There could be rumors or misinformation in the media. There could be community-level rumors. Let's say a village chief has heard a rumor and has mobilized his entire village against vaccination, and everybody's refusing the vaccination. So what do we do? What is the response? Who makes the decision at that community level or district level to respond to that? Does it require broader response, or is this an isolated event in a single community? All these things have to be discussed at the district level and deciding the most appropriate action. And so that's just to show that, and I would say that the C4D consultant who's deployed to the district can provide support, and I hope we provide the McCann presentation on the crisis communication planning and the process in the resource package to our C4D consultants, so they can also revisit that. And I think these are issues that are not necessarily always discussed and addressed at the district level, but in the COVID context, where there's already misinformation about the vaccines circulating globally, and even in North America, in the US particularly, there's a large cohorts of people that have already decided that they will not vaccinate themselves against COVID because of some rumors and misinformation that is circulating. So this can happen in any part of the world, any country, and unfortunately sometimes they can be mistakenly linked to polio vaccine, and hence the polio program is suffering from it. So it is important to think about these issues and be prepared for these kinds of crisis situations, because at the end of the day, our goal is to vaccinate every single child, and any kind of a misinformation or misinterpretation of, let's say a child gets a MAPI, a fever, and then linking that to broader issues about the quality of the polio vaccine can have very dramatic impact on the actual vaccination effort and the coverage. Next slide. I think the next slide is okay. This is really more the community engagement linked to, which is also could be linked to the crisis communication, but this is just looking at how in community engagement you can identify different phases in the death of the immunization, death of the engagement of the community, if they are just informed, if they consulted, if they actually collaborating, and if they actually leading a certain response. So it just shows you that we obviously always strive for the deepest possible ownership and leadership by communities in any response. We feel that this will bring the best results for the vaccination. Often this is not happening because of the time and time pressure, and often we see in the field that it's really very minimum kinds of community engagement that is happening, and it's more about informing the communities through mass media, which is not ideal, and we always strive for finding ways of going deeper in this whole spectrum of kinds of community engagement you can implement for the program. Next slide. Okay, this is repeating, getting past this. And this is just to remind that after the crisis, there should be this process of, I think somebody's mic is open, so. Just to remind that the crisis team, whether it's at the district level or the national level, should look at the different aspects of what was done, the processes in place, etc., messaging, and do a sort of a post-mortem to understand if the system was working. And also in the yellow box, it's important to reminder that that the response to any potential crisis, whether it's misinformation, rumors, has to be proportional to the gravity of that, the seriousness of that crisis. If not, you risk of actually making amplifying the misinformation and rumors. So it's a very important process to assess the potential crisis appropriately, and then designing the response that is proportional to the seriousness of that crisis. So I leave it at that. I think there will be then questions in the Q&A period. I think that was the last slide. So thank you very much for listening.
Thank you, Tommy. So I believe now we will go into a short 15-minute break. Is that correct, Lorraine?
Yes, we'll go into a short 15-minute break, and then that's fine because we come back into the Q&A and we have time for that. So we'll go until about 9:35 our time, which is
3:35.
15:35. Okay. Okay. Thank you.
Thank you, everyone, and I'll put a timer up on the screen so you can see when to come back. And in the meantime, you can enter any questions. Right. Anyway.
Thank you, Erin. themselves. So these are just guidelines that we give, that it is the government, the Ministry of Health, and who will actually come back and give guidelines for what is used within the country. So for Republic of Congo, these guidelines would come from your Ministry of Health. If that answers your question. Over to you.
Merci beaucoup. J'ai bien trouvé des mots de réponse.
Thank you very much. You've actually answered my question. I thank you very much for that.
Thank you. And Thomas, is there a second question on one of the slides from Lorraine's presentation earlier?
Oui, effectivement, il y avait.
Yes, indeed. There was a slide, one of the slides, reading something about we're going to do something. And Simon was, yes, that's the slide I was talking about. Where are we going? I think you can ask your question again, I think. Lorraine, just a minute. She's going to ask her question again. Just a minute.
Sure.
All right. I was saying that looking at the C4D with the arrows here, I realized that this slide has changed a lot as time went by. Now, my question is, given the time ahead of us, are we going to have enough time to play out, to implement all these facets of C4D? Second question, given the advent of COVID-19, mass communication will not be happening. Is it possible to use digital communication so that wide-based, broad-based external communication be implemented? Do you think that this will be possible?
Okay, I'm just going to come back to Simone. I'm going to try and answer this to the best as I can, just coming from what I understand. Coming back to the first part of your question, if you remember earlier, I had shown a slide, I think it's in, here we go, in this slide deck, and Tommy was speaking a little bit about this in his presentation. If you look at the bottom, there's the different phases that we go through. There's the outbreak phase, there's the enduring, and there's the maintenance. And Tommy was talking to you about the timelines of when we do different things during an outbreak phase. And so when you look at all these different components over here, you can kind of look at them as a communication strategy. So it's not necessarily that you are doing everything necessarily at the same time, but what our job is and our responsibility is to make sure that we talk about these topics and that we make sure that you're aware of them, but they won't necessarily happen at the same time. I can point to you a little bit on the bottom when you look under the green arrow where Tommy was talking about crisis communication and looking at the SOP phases. This is under the yellow arrow, which is more community engagement. These fall in different times in an outbreak. Okay, so it's we need to know about them. This is cyclical. There are parts of it that will mix together. There are parts where one will be more important than the other. That for us, from the lens that we look at it as facilitators and trainers, is to make sure that we cover the different components of a communication outbreak, if that helps. When we talk about digital, and I'm going to throw this back at Tommy to answer this, we will talk a little bit more also tomorrow about digital, and we're not saying that we just look at mass communication. As communication officers, when we do our channeling, we lay them out in our plans and processes, and then we determine what works best for us then. So mass communication might work for me if I was looking at an environment where maybe you could use radio a lot quicker and people didn't necessarily have reception for telephones. So these are the things that we consider when we do our planning processes in country of what we're using. And it doesn't mean that we can't mix one with the other, right? It's like, where's our target audience? What am I trying to get to? And what's the quickest way of doing that? And as we all know, mass media is one of the quickest way and a very cost-effective way to reach large populations very quickly. But I'm going to throw that question also back to Tommy to see if there's anything he'd like to add to it. Or Thomas, up to any of you.
I can add a couple of things. And I think there was another question on the screen from another person that since we are in an outbreak emergency, do we have to follow all these different steps? And I think to our best ability, we should, because C4D, as we said earlier, is a systematic approach. So the steps are there for a reason. For example, understanding the context, the data, understanding who are the influencers, how do we map our different audiences, where do we have high-risk groups, or where do we have hard-to-reach populations, what are the most effective communication channels, and that's linked to Simon's question, how do we do community engagement in COVID context? That's a very good question. You're not supposed to have large groups of people and a person with a megaphone yelling at them, which in the first place might not be so effective. But secondly, it would be linked to the do no harm principle that we talked about earlier. So the COVID context is critical to determine how do we communicate with these communities. And it's also linked to the digital. So we know from data that Congo Brazzaville, if I remember correctly, Facebook had was it under 2 million or 3 million people in Congo Brazzaville, and mostly in Pointe-Noire and Brazzaville. So we can't rely only on the digital and social media. So that's why the C4D process is a strategic process where we analyze and assess our opportunities to reach our communities so that we can engage them in a way that would make them not only informed, but also make them to be ready for the vaccination campaign when it arrives, and actually then vaccinate the children. So the steps are there for a reason. So these are all key critical elements in a planning process. Most of these steps that Lauren showed that have already been done in Brazzaville. So there's been a huge effort at the national level. For the C4D consultants who are going to be deployed to the districts, that's where I'm personally concerned. Do we have effective district level operational communication plans where these steps have been looked at? Do at the district level, have they mapped the special populations? Do they have a system in place to track rumors and then decide an action on that? Have they mapped the different influencer groups? Have they engaged different media that may exist, community radios and others? So that's where the C4D consultant that are going to the districts, that's where your role is important. Maybe not to say we have to go through every single step, but have you looked at all these different critical issues that we normally would do in a C4D planning process? So I don't know if Thomas, you have other things to add, but that's my answer to the question as well. Thank you.
Thomas, over to you. Do you have anything to add to this question?
Merci, Tommy. Je crois que c'est.
Thank you, Tommy. I think that you've answered the questions. I think that he was saying also that as we are talking about the first phase, where we have to carry out activities in the period of 14 days after notification, do we think that during that period will be able to undertake all these activities in that time frame of 14 days? That's basically the question that he was asking. Are we going to go through the various steps during this period of 14 days?
I've worked in many outbreaks, both in endemics and outbreak countries, and I have never seen a country that has followed to the letter the timeline that we have. These are obviously something the program and the country should aspire towards and try to reach. It just to signal that it is an urgent issue, and it's not a business as usual. And that's why I think these timelines are being set so that the message is also transmitted to the countries that you have an outbreak, you need urgent action, and these are the guidelines we have. But as I said, in my many years in polio outbreak response, I haven't seen a single country that would have been in 14 days in fulfilled all the different phases we have. So not to worry, Brazzaville. I think you have done a great job. I was there for a couple of weeks just recently. The BEV has done an excellent job. The UNICEF support, WHO support, the CPI support has been there. Now, when we go to the operational level, that's where we have to actually then make sure that things are happening. But to the question that do we have to do everything 14 days? Ideally, but as I said, it's not always possible. There's so many different factors can affect that. Thank you.
Thank you, Tommy. So we have a few more questions that have come in through the chat from Malay. And if anyone has questions, please, I invite you to raise your hand. You click participants and click raise hand in order to ask your question aloud to the group. You may also write your question in the chat box. So the next question we received from Malay, quels sont les mappies possibles du vaccin contre la polio? And I invite the interpreters to read that back to our facilitators in English, please. The second question on the screen.
Okay.
What are the probable mappies of vaccine to control polio? Lorraine? Well, I can give the initial answers. I don't know whether Claude is still on the call. Claude, are you on the call? Are you still on the call, Claude?
Claude is on the call, yes. And you can feel free, Thomas, to give the initial answer as Thomas, and Thomas, we can go, Claude, we can go to next.
Okay, d'accord. Bon, ce que je peux dire,
all right.
Le vaccin contre
But I can say that the polio vaccine is very safe, very good quality. Actually, there's no side effects. There's no actual side effects as that would happen with other vaccines. You need to remember that the child may feel a little bit feverish, but sometimes it may be due to another disease. But in actual fact, the vaccine does not bring about side effects as this may happen with other vaccines. People may tell you from time to time, that the child had a diarrhea, but these are not things that are seen on a wider scope, on a wider scale. I don't know whether you wanted to add something. Over to you. Over.
Thank you, Thomas. Yes, go ahead, Claude.
Yeah, okay. Thank you very much. Merci beaucoup. Je crois que Thomas, tu as déjà donné la grande partie.
Thank you. I think that Thomas basically said it all and gave an answer. The colleagues should understand that what really matters as we speak is to remember that we have categories And you will see that in the forthcoming days, we will use the protocols. For instance, when these are very simple mappies, a few things that the child may feel here and there, there's another way to behave. And when the mappies are average or serious, so we try to adjust our protocol to the way we communicate, we engage people. So I think that very often these things are not very serious, small cases of diarrhea. And that sometimes the child is very sick after vaccine, but it's not necessarily because of the vaccine. We remember that there were two children who passed away after the vaccine. So the MAPI was very serious. So we were really panicking when we were confronted with that case.
Thank you very much, Claude. Tommy, I saw you unmuted. Did you want to come in? And I also see a hand from Magui Bimbalu. We can go to you next.
Okay, so I saw in the question that we didn't answer from Amal, I think. What are the consequences of non-compliance? What are the consequences if parents refuse? Well, the immediate consequence is that their child will be at risk of contracting polio, and also children in that community in general. So, but operationally, what happens? There's a system to track refusals, and I think those tools have been gone through by Thomas already. And normally, during a campaign, you have an evening debrief meeting where issues encountered during the day are discussed, and the team should also discuss where there are communities where there were a lot of refusals, and there would be an immediate plan for next day to address those. So we don't just leave them as such, but they will be addressed then by a team that would visit if it's a broader refusal community. If the individual refusals here and there, they can be addressed also, but often we focused on if there's sort of a larger refusal communities, to send a special team next day to address the community's concerns about the vaccine. So those would be the consequences from my perspective. Over.
Thank you, Tommy. I see a hand from Elodie. Elodie, would you like to unmute and ask your question or provide your comment?
Merci Laurette. Je reviens encore sur la question.
Let me take you back to the issue of MAPIs. You said that there are, after vaccination, after polio immunization, there is MAPI. We spoke about fever and diarrhea. As a communication officer, we would like to know, if we are in the field and we have cases of MAPI, what do we tell the people? Are we going to tell them that it's going to take 2 days, 3 days? How long will the diarrhea last after the immunization? Thank you.
Aaron, this is Lorraine. I think maybe we should get this question to Thomas. This is a little more technical and also messaging. To Thomas or Claude, if you can answer, or you have any comments or suggestions.
Thank you, Lorraine. Thomas, over to you.
Okay.
Or Claude first. Yes, go ahead.
Okay. Merci beaucoup
Thank you very much for the question. And I spoke about MAPIs in general first, and then MAPIs to do with polio. We already need to say that MAPI with regard in relation to polio. Sorry, the connection is very poor and we are really struggling to make sense of what is being said. We can hardly hear the gentleman. Can you please check his connection?
Yes.
In the prospect of communication, when we come across cases, we see that, for instance, there's a diarrhea, we try to reassure the parents. Tell them that it's a side effect, just like you have with any other medicine. For instance, anti-malaria drugs can lead to side effects. And that does not prevent the patient from healing. So these things can happen. And we need to make sure that we share this information. Because if you take polio immunization, that means that you will avoid paralysis. And a diarrhea is just something that is lasting for a while, and then you recover from it. So that's a message that you can share with the parents if they're worrying. Because at the end of the day, we're talking about protecting children against polio and possible paralysis. And tell them that it is not uncommon to have a MAPI in case of polio immunization. Thank you. Thank you, Claude. Now, when it comes to the polio vaccine, as we said, we do not have serious side effects, but as Claude said, we just need to reassure the parents that when there is fever, when all you need to do is take paracetamol, and so you need first to reassure the parents. And this diarrhea that you see is not necessarily related to the vaccine also. So you need to reassure the parents. So this comes under crisis communication, and you have to make sure that you have a positive impact on achieving the results. This is the message that I wanted to add in addition to what Claude said.
Thank you very much, Claude and Thomas. We have a few hands. Next, I would like to go to Magui Bompaliu. You can unmute.
Oui, donc bonsoir tout le monde.
Well, hello everyone.
Hello, yes, proceed.
Hello everyone. I have two concerns. Number one, can we please ask the lady to speak clearly and loud into her microphone? The interpreters are really struggling. Sorry.
Yes, Thomas, excuse me. Could you ask the participant to please move closer to the microphone in the room for the benefit of the interpreters?
Ok, excusez-moi.
Much better, thank
Voilà,
you.
Lors de
I was saying that in the presentation, it was said that after the outbreak is announced, there should be a response within 14 days. In the Congo, it was on 15th of October, and it is more than 14 days, and we still are waiting for a response. So communication is already prepared and the message is available, and all the messages for the response are available. So is it not possible then, before we start the response, to start upstream communication messages? Because I think we can start with communication pending the start of immunization, so that we can help reduce the probability of the disease spreading. That was my first concern. Now, the second concern, I will share some experience with you. We've carried out activities for mother and child, and I have noticed that people who were connected were more focused on the COVID-19 response than on immunization. They were focusing rather on treatment. So are there not strategies that would enable us to draw the attention of our people on our immunization activities rather than COVID-19? Thank you.
Thank you for
I can try to answer on the first concern. Just to repeat what I said, these standard operating procedures are there to drive the message of urgency. What happens on the ground depends on how the country is prepared and supported. And as I repeat again, I've been in outbreaks where nothing is in place in 14 days. So it's an indicative measure to strive for, but there are so many factors that affect our preparedness and being able to launch the campaign that often come to play and makes the situation such that we are not be able to follow these guidelines and these timelines. What should be happening already, and I used to work in Nigeria for a couple of years, where we had our local guidelines saying 2 weeks before the campaign launch, there should be active community engagement and communication through mass media underway. Otherwise, we are not ready for the campaign because we have not communicated and engaged with the communities in advance. I don't know where Brazzaville is now in terms of, I understand messages are there, but is there already a media campaign underway? Because to my understanding, the campaign starts on the 10th. So if that's not the case, I'm wondering why not. But I mean, just to come back, there are indicative guidelines that we strive for, but often for various reasons that you stated, we are not ready to launch. So that's why it's important to strive for these guidelines, but also acknowledge that we cannot always meet those guidelines. Yeah. On the second question on the immunization, I think it's an issue, and in many countries we have seen it. I work in Afghanistan and Pakistan. You know, the immunization rates have gone down, and people are concerned about door-to-door contact and so on, but they can be overcome with proactive communication. And in Pakistan, for example, there's a CVDP outbreaks, and there's, as you know, there's the wild poliovirus circulating, and there's extreme efforts underway to raise the risk perception of vaccine preventable diseases in the country, so that the parents would continue vaccinating their children. So through mass communication, we can address the people's perceptions of the urgency of vaccinating their children, and it should be part of the overall messaging for this campaign as well. So we can also boost on not only polio vaccine, but also routine immunization in general. So that's my response. Hopefully that answers your questions.
Yeah. Aaron, it's Lorraine. If I can add to that slightly, I mean, also based on what Tommy is saying, and yes, we are the polio program, but I think we also have to remember at the initial beginning of when we had the pandemic started, when it was actually going completely into pandemic state. One of the things that UNICEF had come together and from our senior management that we had looked at was to actually discuss that let's put all hands on deck and let's try and get this under control and give support where needed. And you know, the polio program in a lot of countries, a lot of this also falls under the immunization section. So you know, there's a lot of things when I was speaking in the beginning, and there's a lot of wheels moving at the same time. We have to keep this all in consideration too. I mean, a prime example was our colleagues who just flew into Brazzaville and still had to do quarantine for a few days. So even though we say let's do something in 14 days, there are other things that also affect our daily operations that will hold things up. So I think it's just important to remember that. And also to remember when we talk about the duty of care, if we say all hands on deck and let's try not to you know, let's take care of communities and let's take care of our own health workers. This all plays into it too, right? It's like, we can't say one thing and we're trying to prevent the spread of the pandemic and then at the same time say, let's all go out and start a campaign on something. So there's a lot of things that move internally too, and calls from government and agencies that we take into consideration.
Thank you, Lorraine. Thank you, Tommy. Next, any other responses to this? Or next we have a question from Sanga Sotarin. Sanga, are you able to unmute and ask your question?
Ok. C'est bon, vous m'entendez?
Can you hear me? Yes, we can hear you. Thank you. I'm Sotarin Changa, consultant, polio consultant for headquarters. I'm currently on the mission in Chad. I would like, if you allow me, to take you back to the issue raised by Elodie on mapping, and to add to the response provided by Tama, I would like to say that when it comes to the polio vaccine, oral polio vaccine, it is recommended, for instance, that all children, whether they are experiencing fever or not, that they be immunized. There is no restriction just because the child has fever. To say that this is a vaccine that is safe and effective, it is recommended to share this message on a regular basis. The vaccine is safe and effective, and that's why we say there's no restriction when it comes to vaccinating a child who has fever. So if you meet with a child, with a parent who will tell you that the child, after being immunized, has fever, we have had situations sometimes where we have had mappies, serious mappies, or simple mappies that were just related to coincidence. Maybe there was already another disease affecting the child, and it must just coincided with the moment they were vaccinated or immunized against polio. So what is most important, as has been said, is to reassure the parents by telling them that the polio vaccine is safe and effective, and then ask the parents to report to the nearest health center for free health care, for free case management, and make sure that they report there. Thank you.
Thank you, Sangha, for that additional information. So we have a few 5 minutes left for questions, and there are 2 questions remaining on the screen. I think Tommy may have spoken to one of the questions, but I'd like to turn to these 2 questions for responses. So could I ask the interpreter to please read? Go ahead, Thomas. Could I ask the interpreter to please read both questions in English and French? And we'll open them up.
Now, number 1, regarding the evaluations for 3 months, what are the indicators, the communication indicators?
I think this is more for Geneva outbreak team. The outbreak assessments are normally done after 3 months of the response, and there are clearly defined indicators for C4D that should be looked at by the outbreak team. Last time I was involved in an outbreak assessment was 2017 in Cameroon, and but since 2017 I haven't seen any outbreak assessment missions, but maybe Thomas and Claude can respond this better than I can. So Thomas and Claude, if you want to specify any outbreak assessment details that are asked in the question.
Thank you, Tommy. Thomas, I see you.
Ok, merci Tommy. Je vais commencer peut-être sur Claude.
Thank you, Tommy. I don't know who asked the question, but it would be advisable that we know who it was and that we share the key elements, because there's a lot of data at stake here when it comes to C4D.
Yes,
so
this was Amadou Malé.
It's a number of elements that we need to prepare. So if you have the name, because I don't see the name of who asked it, because it says anonymous.
This was Malé.
It's Malé. It's me, Malé, please.
For these 2 questions.
Okay, Malé. There's a lot of items here. I asked the question because when we receive the other missions, prior to the arrival of the mission, we talk about a lot of things, and when the mission comes, often there is no specifics. So I asked the question so that we, as C4D, we be prepared if there are any standard elements that we need to prepare, any standard items for an evaluation, for an assessment mission, so that we can look into that for the 3 months before the evaluation mission gets in. That's why I asked the question. Thank you. Thank you, Malé. It's true that there are a lot of elements and there are sectors that we need to take into account. The first thing they will ask you about is on documentation, all the activities that are carried out in terms of advocacy. It is important to have this properly mapped. And then they will ask you about mapping of special groups or population. They will ask you the deployment plan, the progress plan for the teams. All this will be asked of you. They will ask you about data and monitoring, and a lot of elements that you need to prepare for before the arrival of the teams. So I will share this with you after this training. Thank you.
Thank you, Thomas. I see LOD. Go ahead, Lorraine.
I was just going to add to it that I was actually on an OBRA mission in February. So if it's helpful, this was for the Philippines, I can share some of the data that we collected and looked at for the comms component of it. And I can put it in the resource file.
Yes. OK. Non, je crois que pour aller dans le même sens que Thomas a dit, Malé, je crois qu'actuellement, ce qu'on fait déjà, dès le départ, on partage avec vous tous les critères. Parce qu'on voudrait que pendant que vous êtes en train de mettre en œuvre la réponse, que vous ayez déjà ces critères avec vous. Comme il a dit, est-ce que les cartographies, est-ce que les populations, tout ça, là, ce n'est pas à la fin. Non, non, il faudrait que dès maintenant, que vous les ayez, que vous les partagez à tous les niveaux, que ce soit au niveau régional, que ce soit au niveau des districts. Tous ces indicateurs, vous devez déjà les avoir avec vous et vous rassurer que pendant qu'on met la réponse en question, déjà, on tient compte de ça. Par exemple, il y a une question qui est, par exemple, relative au fonctionnement de votre commission.
Interpreters, I think you're both in the French room. There's no one in English.
Okay, thank you.
Can you hear us?
Yes.
Can you hear us? Sorry. So we need to make sure that we have all of these elements prior to the deployment of the team. And in the presentation that we send the countries, we also need to make sure that we give you the right elements so that you know what it's all about. Thank you.
Thank you, Claude. And Elodie, did you have a comment?
Merci, Lorraine. En fait,
Thank you,
moi,
Lorraine. I wanted to ask Thomas regarding the documents that he'll be sending to the participant who asked the question, if he could share the same documents for everyone, because we all need these documents, all of us. Thank you.
Yes, Thomas, go ahead.
Thomas, allez-y.
Room.
Yes, go ahead.
Ok, bonsoir. Toujours dans
Hello.
le cadre de la communication C4D.
Still, as part of C4D communication, this process uses data. In the case of Congo, what data are we going to take into consideration to try and implement our communication? Are we talking about partial survey data or rapid survey data? Thank you.
I can answer a little bit. We still have one presentation when we talk about the data and which data depends on the country what is available. But already, since I was in Brazzaville, the national C4D plan that the Ministry of Health has put in place with the support of the partners and Thomas particularly, has all the critical data already that was available that is relevant to the planning. Then this is a national level. So now again, the concern is how does this plan translate into operational district level communication plans and the micro planning process where more detailed data should be available for the district level planning. But we have a couple of slides to talk about data, but it's really just to give an idea how complex it can be to plan an effective C4D response if all the data is available, and secondly, if it's been analyzed and applied to the planning. So that's my answer. I don't know how much time we have left, but there were a few slides we wanted to show on the data side. Over.
Thank you, Tommy.
And that's what I was going to add, Aaron. I was going to say this probably is a good segue because it's 10:30 into the presentation on data. Keeping in mind that we could share additional information since these are very short sessions.
Excellent. So let's turn now. Thank you, everyone, for your questions. And we'll turn now to the next session in on data. And I invite Lorraine and Tommy to proceed with this as I get this screen set up properly.
Okay, are you going to control the slides from your side or?
If you have them up, you can control.
I can pull it up. I don't have it up, but. Aaron, I can do it. My apologies. I should have had it ready. It'll only take a second.
I can do it. I have it right here.
I
Okay,
revised it for you, please. I have it. And with that said, I just want to tell people that we will have more time for question and answers even tomorrow. So I don't want you to think that we will not come back to your questions, but we will set up time. Okay, can you see my screen?
But it's the English one.
Sorry, Tommy. Oh.
I have the French if you want.
I have it.
Okay.
I just need to get back and share screen. Voila. All yours, Tommy.
Okay, yeah, so just briefly, I think there was a pertinent question from the gentleman just earlier. What data should we use? And I think the answer, first of all, before we go in, what data should we use is that C4D as a strategic response to polio should be relying on existing data that is available in the country. And there's different types of data that normally in the planning process we apply, and we interpret the data and try to understand what does this data tell us in terms of our strategy and our response. And everybody's been talking about, even during when Thomas talked about the OBRA, the outbreak response assessment, there must be data in the country on the media mapping, on the mapping of the special population. There must be data on the various demographics in the country. There must be data on various special populations. There must be data on the previous SIAs or polio campaigns. Like we've seen in the national plan, there is data on the response that was on the campaign, a preventive campaign that was done in November 2019, looking at the results through the independent monitoring data. So all kinds of different data exists. Now the question is, do we look at it and interpret, and how does that interpretation affect our strategy? And this can be done at the national level because it's done at the national level in Brazzaville already. And now the question is, how do we then apply this available data at the district level for the operational plans? So just quickly going through a couple of slides. So basically, this kind of a situational contextual analysis should be the foundation for a good, solid C4D plan. And in some countries, there is a wealth of data. In other countries, there isn't. So it depends on what is available. And often in an outbreak response, there's no time to start collecting new type of data. Although we will be talking about rapid data collection tools as well that are designed to, in an emergency context, quickly collect some relevant data, particularly social data at the community level, that would be helpful for the C4D planning process. Next slide. So this is just listing quickly for you. I'm not going to go into details. You can read while I speak, but there are obviously, and we can see it in the national plan, there's all kinds of demographic, geographic, social data that can be looked at to help us design appropriate localized strategies. There's data on various religions. There's a data on the different EPI data, the Ministry of Health data that can be looked at. And all this is happening in the initial phase when we start strategizing for polio response. And as I said, this has already been done in Brazzaville. So I'm sure each C4D consultant has the national plan in their resource package, because it is key, obviously, to guide you also when you go into the districts. Next slide. We're looking at data of the previous campaigns. I talked about previous polio preventive campaigns in 2019, routine immunization data, where are the children that are not vaccinated, what are the areas with the lowest coverage, where are the areas where the polio response in 2019 had a lot of issues around refusals or not available children. Next slide. And then, so we collect this data and we have these key questions on the left side under données, and we try to utilize that when we try to tailor our C4D response within the country. And this is critical because the national plan is not the only plan we should have in place. We should have those plans at the lower level. I think in Brazzaville, the département and the districts is where we would then go deeper into this existing data and try to tailor our response so we don't miss some special populations, we don't miss certain influencer groups that can be supportive for the campaign, and we don't miss existing religious or community radio channels that can be utilized. So that's where the real critical operational planning happens. And then we take action and implement the plan. And sometimes we are late with the plan and the implementation is the last minute, but we do our best and we strive for the best response possible, obviously, to have a quality campaign. Next slide.
And Tommy, could I interrupt for just a second? I wanted to check for Thomas in the room. Are you able to hear the interpreter well? There was a message in the chat for the interpreter to please speak more loudly. I think you can continue, Tommy.
Okay. This slide again talks about...
Actuellement, ça va.
Okay. Thank you. Merci.
Oui. Là, quand vous parlez, ça va. Franchement, on ne sait rien.
Well, we can hear properly. Really, there's no issue at all.
Okay. So this slide is just listing more of the health related data, surveillance data, routine immunization data, previous campaign data. We have all this LQA data from the polio campaigns. All this, I think, the program and the Ministry of Health in the current national plan has taken into account to give us a picture where the country is in terms of this situation when it comes to the data. Next slide. Then from the program itself, and obviously we look at, as I said earlier, if there are any existing data from the previous campaigns, reports from EPI program, any evaluations, if there was been an OBRA in the country or not, if there has been any other relevant data from the health sector like mix research, mix studies, and also looking at if there has been any knowledge, attitude, and practices, behavior data through a research that has been recently done. So as you can see, there's a whole sea of data that we're supposed to be looking at, and often it's not necessarily easy to interpret, but definitely it is something that the C4D approach as a strategy always should build its response on the analysis and interpretation of the data that exists in the country. Next slide. In the media front, as we said earlier, the C4D response uses media as a channel, and the country I know has already done some mapping of the existing media. There's been also a sort of an interpretation of what have been in the past possible sort of a media-related misinformation or rumors that have been circulating in communities that could affect the success of the campaign. The social media scene in Brazzaville it's quite limited, but definitely that should be also part of the existing sort of a planning process on what are the social media channels utilized. And as I understand, it's mostly in big urban centers and mostly Facebook. But also if we have standard messages going out to support the campaign, they should also be prominently featured on Facebook, particularly in Brazzaville context. Any other sort of communication marketing related data that may exist that would tell us something about our audiences is as they relate to acceptance of immunization in general or polio. All these would be important and valuable data that can be used in the planning process. But again, in the Brazzaville context, we are already beyond this point. The national plan has been finalized, and there's been a mapping and analysis exercise has been done. And now it's really moving all this work into the districts and operationalize the communications work and the community engagement work as much as we can do at that level. Next slide. The microplanning process, I think Thomas has already quite extensively talked to this group earlier last week about this and how important it is that there are good quality microplans at the lower level to map the various groups that need special attention, that maps all the different influencer groups that can be engaged, and different community radio, religious radio stations, etc. So this is hopefully in place in the Brazzaville for this upcoming campaign. Next slide. We have recently finalized from New York side a rapid data collection tool guidance document, and it is in your resource package. But I just wanted to, it's also linked to the question that I think the gentleman asked earlier, is that what kind of data should we use and how can we rapidly collect some critical data? And I think this is really, I'm particularly looking at now when we are between the first round and the second round, when the C4D consultants are on the ground in their respective districts. So it could be interesting to see if there are clear areas of challenges in any given district. How can we utilize some rapid qualitative data collection tools to understand better, for example, why there is a widespread, if there is one, hopefully there won't be, widespread refusal to polio vaccination. It could be simply done through focus group discussions. It could be organized in a safe way in a COVID context with social distancing and masks, but it could be something really critical, community level data, if there are some major issues around vaccination acceptance in some districts. And I don't want to go in detail through this because I think we have this information in the package, but it's really looking at the what are the key questions to evaluate, what are the resources and the tools we have in our possession to do some standardized questions in different districts that give us idea of the issues that are being faced. Hopefully there won't be any issues, but in case there are. And obviously, they should be done in the local language, depending on which country are we in. Next slide. And then obviously, we should utilize resources that are in the partnership, in the government, in the local district level, and to put in place a process whereby we could collect important community level qualitative data that could help us address vaccine acceptance issues if they arise. And then it gives you some guidance also on the approaches you can use to collect this data, maybe through mobile technology, maybe through WhatsApp groups. And it gives you guidance also, this document that we share with you, on the different ways of connecting with the community and conducting the interviews and the discussions. And then also it gives you idea how we can then examine the results and utilize that data that we collect to make the second round more effective in these potential problem areas that we might encounter in the first round. Next slide. And obviously we need to validate the data and make sure that it is validated by the Ministry of Health if we collect this kind of data before we distribute anything for broader audience. And we have to make sure that we also then at the district level we learn and interpret the data to guide our response so that the second round can be better. So, but definitely it should be done in a coordinated manner. And I'm not saying the C4D consultant should be driving this, but this is an approach that could be useful at the district level to be discussed with the district level health authorities. If in any given district where the consultant is working, there are some serious vaccine acceptance issues. So this kind of a rapid data collection tool, research through focus group discussions can be very helpful to guide the response and resolve the issues before we enter the second round. So you please have a look at that guidance document. It is available in French in your resource package. And then maybe even if you have a time tonight to look at it, then maybe if there's further questions tomorrow, we can try to answer them. So that it's a lot of information, but I think the key message is that we'll try to complement the existing data always in a C4D response, if possible, through some rapid ways of collecting qualitative data, and so that we can have a more effective response in the second round. And if you have questions, we have a resource person in New York as well. His name is Ross McIntosh. His email is on the screen, who actually was the architect behind the guide. So he has a lot of experience in this area. So his email is there on purpose for you to address him directly if you have specific questions around this kind of approach. There's also resources on the rhizome. The link is on the screen as well. So definitely we feel that this is an area that can have a meaningful impact on the quality of the campaign in cases where there are issues, widespread issues, particularly about vaccine acceptance or refusals. And it would be important to utilize these tools in coordination with the authorities in the country. This is not an effort that UNICEF C4D consultant should take on himself or herself alone, but it should be done in coordination with the district level team and decide whether this is something that should be undertaken and if it's the appropriate way of trying to improve the campaign quality. So that I think we just have to finish now, but if you have more questions, either tomorrow during the QA or as I said, Ross McIntosh, his email was on the screen. He also speaks some French, so he can also answer your questions in this area if you want. Thank you very much.
Thank you, Tommy. So that completes our sessions for today. At this point, we would like to go over the agenda for tomorrow and go through a poll to collect more questions and feedback from today's presentations. Lorraine, would you like me to show the agenda to walk through it?
Sure, Erin. And I just have a couple of other points. So
go ahead and I'll get the agenda shown.
Okay, sure. I just wanted to, while we're getting the agenda up, to speak about what we would cover tomorrow. I'd also like to thank my colleagues for the support given to help facilitate this session. And Thomas, very much thanks, especially for all the hard work and the time difference and for everything you've done to help us support this. I really appreciate it also. So we'll do a slight poll. Just to come back to the poll that was done this morning, when I took a look at it at break, a lot of the points that came up, I hope you can see that we are covering these in the trainings. There was talked about influencers, community engagement that we'll look at tomorrow, refusals, which is part of the IEC, coordination, supervision, which continuously come through the trainings. All right, if we look at the agenda for tomorrow, tomorrow is a little bit of a shorter day, and I think we will look at it a little bit also more, kind of focusing a little bit more on the, not a little more, but we will a little bit on the behavioral aspect of things, where we will look at our target audiences and just do a lot of discussion based on that, which is the behavioral component of it. And then we will come back and address parts of the microplan that you did with Toma earlier this week. And then something that is huge that we really need to focus on will be discussion about misinformation and rumor tracking. And a lot of this looking at it on the district level too, which Toma and Tommy will facilitate. And then at the end of the session, I would like to do a quick soft skills discussion with you all, looking at supportive supervision, coaching, and mentoring, especially since a lot of you will be playing this role in the field. We will share the resources with you. As Tommy said, you might want to take a look at one of the documents for tomorrow. And I think that's it from my side. Just to begin tomorrow morning, we will leave time. We won't have to go through the formal introductions, to leave a part over there for Q&A. And as I said, Tommy will join us an hour later. So I'll hand it back over to you, Aaron, and to Tommy. Tommy, you might have a couple of words you may want to say, or Toma.
No, just from my side, I think I really appreciate the commitment of the country team and the Ministry of Health to participate in this training. And as Lauren said earlier, we do have a very abridged, shortened format for this and only very limited time, so we can unfortunately only touch upon these issues quite briefly. But it definitely, I would like to focus on practical things that help you to perform, particularly our C4D consultants who are going to the field, perform your role effectively in the field. So if tomorrow we also have more time for Q&A, I think that will be helpful, because I can see that it can be very sometimes overwhelming that, oh my God, we have to do all this stuff, but there's a lot of things that I keep repeating that are in place. But now it's really important when the deployment happens, is that in the field level, as Lauren says, this sort of a coaching, mentoring, problem solving approach is what you need to be expecting, and particularly during the campaign, the evening debrief meetings is where you can address what you have seen during the day in terms of making the C4D response more effective. So thank you for joining us, and hopefully tomorrow also we see everybody back in the second part of the of this training. So thank you very much for your support. Over.
Thank you so much, Tommy. Thank you, Lorraine. So at this point, we have a poll to finish the day. So if you take a look at your screen, you have two options to complete the poll. In the chat box, there is a URL. If you're on the Zoom link, you can go to the chat and click the link in the chat box to complete this poll. And if you are in the room, you can use your cell phone to take a picture of the screen, and that will also bring you to the poll. And we have 3 questions. So I'd like everyone now to please open this link either on your phone or on your laptop, and to answer these 3 questions as we are wrapping up for today. We'd like to receive your input on whether you have any questions from any of the sessions today. The second question will ask you to think of back on the sessions we've covered today, and to please select all of the topics that you need additional support on. And the last question will ask you to provide any feedback on any problems you had today or any issues that you faced. I'll also email this link out now to everyone in case you are not able to get it from the chat box. So I'll give everyone a moment to find the link now, and please let me know if you have any issues with that. And while everyone is completing the poll and looking at this, Chomad, are there any other last points from the room? Lorraine and Tommy, any final points?
Not from my side, just big thanks
Merci,
to the
Tommy.
country
Bon,
of
dans la salle ici, ça va. Peut-être que...
Well, we're okay in the room here. Well, there's another room on the other side, you know, at the ministry's office. There's already Steve and Sandra following up on us, but for us, it's okay here. It's true that we have additional questions to raise. I'm sure that tomorrow we'll have an opportunity to share those questions more in detail. Thank you.
Absolutely. Thank you, Thomas. And this on this poll link, there is a question where you can write all of your questions. Please do take a few minutes now, each participant, to complete this poll either on your phone or your computer, so that the presenters can have all of your questions to reflect on tonight and make sure that we can address your questions to the best of our ability tomorrow.
Erin, I'd just like to take a minute also to thank our colleagues on the ground, Sandra and all, for the support they've given us in getting this training off. Yeah. Thank you.
Absolutely. Thank you so much, everyone on the ground, everyone online, and our interpreters. I will send out the invitation link now for the session tomorrow so that everyone has that link. We will be using the same link tomorrow to join for this session. And I will also send everyone the link to the poll so that you can submit your questions and any feedback from today. Okay, thank you so much, everyone. We look forward to joining you tomorrow.
If I may ask, Erin, what is the timing for tomorrow? Is it still the same?
Tomorrow we are 1 hour later. So we'll be starting at 3 p.m. in Brazzaville, 2 p.m. In Dakar.
Ending
in New York. And again, ending at 17:30.
Okay.
On the ground in Brazzaville. And if you could again join about 20 minutes before, I'll include that in your invitation to set up the interpreter.
Thank you.
All right.
Thanks, everyone.
Okay. Aaron, thank you. Thomas? Okay. I will text with you guys separately.
Great.
Or just a preparation, I'll set up a call for later, yeah?